if you read about philanthropy in India, you from the outside world, you get the impression that no one is doing anything, and there's not the big numbers that you see from a Gates or something like that, but yet any company I've ever spoken to and many individuals are doing instead very personal projects, and I think they're related to your family, your religion, and these are three examples that we have here of very different ways that people are interacting with education and improving education of children and of adults also. I think, Mohini, if we could just start with you and you tell us a little bit about what the Max India Foundation is doing.
Thank you, Heather. I'd like to tell everyone at the very beginning, in context what Sam was saying, we are focused at the bottom of the pyramid, and that's where we are. And as far as education is concerned, what we in Max India Foundation do is we empower or we make the children healthy enough for their education. In other words, we are focused on healthcare for the underprivileged. We do pan-India immunization because in my mind, preventive health is very important. Health being a basic primary need. If you're not healthy, you're not going to get educated. And unfortunately, poor nutrition, lack of healthcare facilities, and also not enough immunization is what that is prevalent. So across India, we're doing pan-India immunization. We've also facilitated a lot of high-end surgeries like cancer treatment and particularly pediatric cardiac surgeries. So in the last 4 years, we've done about 594. Besides, what we do is healthcare awareness. So there are a lot of talks. I've produced a number of films on very basic things like oral health and hygiene, which we screen at all our camps. We do a lot of health camps, which are diagnostic, and then we don't just leave the people there. If they need glasses, we provide them. If they need a cataract surgery, we provide them. If there's a cleft lip surgery, we get that done, and so on and so forth. So basically what we've been doing is healthcare for the underprivileged with a focus on children. Also, the elders when it comes to these things. And another thing I want to add, a lot of awareness for an eco-friendly environment. Because I think all this goes hand in hand. You can be healthy when you live in a healthy environment. If you have both these, then you're ready for education, which of course is a prerequisite for our growth. And all growth must be inclusive, so we definitely dwell right there at the bottom, and we are trying to build upwards. I just want to say two small things about the topic, philanthropy and education. One is that in India, philanthropy has played a very important part in education because it's a lot of families who came up and who set up very good schools and colleges to provide quality education, and not just that, but also to monitor the running of these institutions, which has helped, and a lot of maybe people who are sitting here have benefited from such education. And the other aspect is that I think philanthropy has to be a part of education. And I'm saying this because I think a lot of people here are involved in the process of education. And I think ethics, moral values, and the concept of philanthropy as such must be embedded. It must be a basic concept starting right from school. And that is when we will all be sensitive, as Sam was saying now, that many of us are not really sensitive to the needs, and we think we can grow. So I really think we have to start right there, and all those who are involved in education must keep that in mind. And I would like to offer on my part, all those who are looking after different educational institutions, particularly children, and perhaps in the rural areas, you're welcome to approach us, and we will give you all, that means the complete immunization for children, totally free of cost. And please do get in touch with me at the end of the day. I hope that answers in brief. Thank you.